Okay, thank you very much for waiting again. I wanted to just check if I'm audible. And yeah, just a second. Thank you very much. Okay, the time is 17:33, and I think we're going to start. I'm not going to wait for people to then join. Okay, just a second. Okay. I'm not sure if I'm audible. Can someone just say hello, how are you, so that I can maybe hear if it's a corner? Okay. I can't hear anyone yet. So hopefully we can all hear. All right. No problem. Just a second. I'm just making sure that I don't have to keep on admitting people. Great. Just a second. Okay. I think we're going to start. Anyone who will be joining us will then have to, yeah, just come in. Okay, today's session is basically on annotation. The reason why I'm holding this session is because as I was just working with interns, I realized that many of them are struggling with how to annotate their work properly. You find that they have really good evidence. They want to tell the story, but there is a lot of gaps in how they then annotate and link their evidences accordingly, then which leads to work coming back unsuccessful. Just a second. So the hope today is to just help interns know how to annotate different types of evidences and the requirements for when you do annotate your work. So that by the time that you annotate your work, you understand what you are able to meet it and you fulfill all the requirements for the annotation, yeah, as it is stated in the requirements according to the behavioral statement. But before we start, let me just tell you a bit of who we are and what we do. So we are Eden Healthcare Solutions. We are now registered with SARS. We are a registered entity. We are focused on removing the barriers in the lives of others so that they may live a life of purpose. We aim to provide practical solutions through healthcare. So healthcare education, healthcare resources, you know, aiming to play a very important advisory role now with NHI coming with a pharmacist position question for a lot of the time. So we aim to bridge that gap. We also aim to improve on our public health initiatives, making sure that the people who actually need the help most actually do get it. And we also provide this through science and innovation. There'll be a lot of resources. I'll share the details as we go along. So the focus is to equip, it's to empower, it's to develop individuals and communities through meaningful healthcare and learning solutions. Okay. It is also through professional development, which is the purpose of this CPD today. Okay. Our mission is to equip individuals through healthcare, learning, science, innovation, and practical development, CPD tools. It is to empower growth and meaningful impact. That even after we are done with this CPD, we are done with the sessions, we are able to give back to the communities because of the work that we do and because of how we do things. Okay. Our objectives is to remove the barriers to growth, particularly in the area of CPD, knowing and seeing that pharmacists, and interns alike are struggling with this area. They think it's a barrier to their growth, to enjoying the life that they so deserve. But it's not. It's really good for our growth and the growth of our communities, our hospitals, through meaningful impact. It is to promote continuous education and learning, because anything that doesn't learn, that doesn't grow, actually dies. So we aim to provide a culture of continuous learning. There is always something to learn each and every day. It is to equip through practical solutions and tools, through resources, through interactions, through participation and collaborative practice, knowing very well that we are who we are because of the people that we do life with. So we aim to create, a collaborative approach to how we learn, how we grow, and how we impact people. It is to support healthcare and education. Now we are aiming to move into universities, knowing that from second year, students are then introduced to the concept of CPD. And I believe that the sooner they are introduced to it, the better, because then with third year and fourth year now with your internship, it will be just a walk in the park. So we're aiming to then, penetrate those spaces. It is to empower communities through service, through public health initiatives, through ensuring that the local pharmacies are supported, with compliance practices, with the requirements, and they can function well and do the work that they're supposed to be doing. Because pharmacists actually play an important role, because before the pharmacist can actually go see the doctor, before the patient can go see a doctor, very accessible. So we want to equip the person who the patient interacts with all the resources that they may need, so that we remove the barriers in the patient's lives as well. So these are our divisions. We've got Equipment CPD Academy. This focuses on CPD training, SAPC exam support, and healthcare learning. The aim for this is to start with the CPD as an introductory approach to what we learn. One of the main problems I realized that is whenever there are CPD sessions that are held, most of the time there's a doctor who's invited. The pharmacist is just put there at the end to speak on, how do you take this drug, but you are an important member of the healthcare team, as much as the doctor is, as much as the radiographer, as much as the nurse. You are very important, and it's also important to understand and know your role. It is also to support interns with exam support. As you understand and provide practical learning solutions, you don't have to fail your exam. You can pass it back in first time. And it is also to promote healthcare learning. There's a lot of things that are happening that I feel the pharmacist can provide an advisory role. Now with the hantavirus coming in, the season is changing, so flu medication, the importance of vaccination, the importance of talking about vaccination even in a primary healthcare level. With the NHI coming in, I see a lot of primary healthcare facilities, and pharmacists actually playing a very, very important role. So you are very important. The other division is Eden Science and Engineering. We're aiming to develop African traditional medicines, drug delivery approaches to speak and advocate for the promotion of healthcare, not just in CPD dosages, but in the spaces where pharmacists were previously not creating a space, but we aim to create them. Again, we've got Eden Pharmacare is a retail pharmacist. We aim at providing pharmaceutical care and public health. This is our main focus. We know that in retail you are supposed to be pushing the numbers, but here we are hoping to promote the application of integrated care. Because patients are taking a lot more medication than they were before COVID. Now they need the pharmacist they can talk to. So we want you to be positioned so that the patient is at the center and the pharmacist is the person that access away, not to go to a physical location. Okay, so now coming into the business of today, annotation. Most of the time, if people have attended any of the slide for all the domains that I do, I believe it is really important that interns understand how to annotate their evidence well, so that by the time they begin telling their story and adding the details, they add the details according to what SAPC requires. I hope now I'm okay. I believe that my mic might have cut. Am I still audible? Is there anyone who is brave enough to say, you are audible, Linda?
Yes, you are still audible, Linda.
All right. Thank you. Thank you. Thank you. Thank you. Okay. I think there's a problem with my mic. Okay, no problem. I will change it later on. Okay. So now annotations are basically how to tell a good story. This is very, very important. First of all, I want you to understand why annotation is important. I want you to be able to annotate different types of text that you're able to include. And I want you to avoid some common mistakes that interns make so that their work becomes unsuccessful. Most of the time, if you understand, most of the time you have access to the resources, you have access to other people's work. Sometimes the problem is how do you then present the work in a way that it does not confuse or the work as to this person actually doing. Okay, so we are going to start with the requirements. When you annotate your work, always ensure that you provide the title. So what is your work showing? Is it evidence one? Is it evidence A? Is it annexure A? Whatever format that you choose when annotating your work is what you then apply throughout. Don't change how you then structure it. Okay. Two is tell us what the evidence shows. Okay. What is this? It's evidence one. Is it an article? Is it a law? Is it a section of the Pharmacy Act? And what is it showing? Is it section 35 of the Pharmacy Act? What is it? Next up, you talk about application. In talking about application, you provide a brief summary as to what's happening in the text that you are providing, just something brief. And then you link that with the behavioral statement. In the way you link with the behavioral statement is you first understand the behavioral statement. You understand the behavioral statement, you provide just a small summary of what's happening there, and you speak on how you applied it. If it's section 35A and you're applying GPP principles, then link it with that specific section and then speak to how you applied it. And then you link with the behavior statement you're addressing. If I'm talking about behavior statement B in that law, then I'm going to talk about the part that speaks about the scope of practice, for instance, in domain 5.3. If you're linking it with more than one behavioral statement, then annotate and explain how each behavioral statement is covered. Okay. I hope this is clear because most interns tend to lose it when it comes to this, is that they include all the work and then they tell a good story, but they're not able to link with the behavioral statement that is being addressed when it's being addressed. Okay. So now let's start with annotating. This is domain 3.5. Okay. In domain, no, not domain 3.5, domain 3.4. Domain 3.4 is about dispensing. Okay, when you look at behavioral statement A, it talks about evaluating, interpreting, preparing the prescription in line with legislative requirements, and informing the patients about generic medicines. Okay, so already you can see that this is a compound behavior statement. It requires you to include a lot of things. Sorry. Okay, so when you are evaluating a prescription, you are, first of all, we can say that you are checking the legality. Is this compliant? Is this prescription that you are dispensing compliant? And what is the doctor's intent? What's the doctor's intention? This is also covered here. So you're evaluating if this prescription is compliant. So when you're checking compliance of prescription, which regulation are you checking? You're checking regulation 33. Hey, slow. Regulation 33 of the Medicines and Related Substance Control Act. This was published in August 2017, not the old one. Don't use regulation 28. It's old, it's outdated, you're going to fail. When you're interpreting the prescription, you are checking what was the doctor's intention. When you see certain medication, maybe like Redac, then you already know that there's blood pressure there. When you see atorvastatin, okay, let's say atorvastatin, then you're thinking cholesterol. And when it speaks about preparing the medication in line with legislative requirement, then you ask yourself, what other legislative requirements are applicable when preparing a prescription? I've already mentioned regulation 33 on this one, okay? And then in the Medicines and Related Substance Control Act, then you have regulation, okay, maybe let me not put it like this. Let me try and, okay, and break it down further so that I don't confuse you. Sorry about that. So Remember, when you're dispensing, there is phase 1, phase 2, and phase 3 of dispensing. In phase 1, you are supposed to check if the prescription is legal. So this is legal. If the prescription is still valid. Okay, so when you're checking the legality of the prescription, already you remember that this is regulation 33. The validity of the prescription, you're checking the details that needs to be provided, but you're also working with section 22A of the Medicines and Related Substance Control Act, which speaks about when a prescription should be presented for dispensing. And it says it needs to be presented within 30 days. So this needs to be provided. In phase 2, you're picking and labeling the medication. So this speaks of regulation 10.6 of the Medicines and Related Substance Control Act, which speaks of the particulars that needs to be on a legal label for medication. In the GPP, it says that you're supposed to use regulation 8.4, but that's an old regulation for labeling medication. So if you do include the GPP, just make sure that it aligns with these requirements here. In phase 3, you're supposed to counsel a patient. When counseling a patient, it tells you the appropriate counseling areas according to the law. Okay, so here you're looking at section 1.2.13 of the GPP. You're also working with section 2.7.1.3 of the GPP, which explains all of this. But now, before you even move to this, like sorry about that. Before you even move to this, remember where these ones, this counseling and all of this, the GPP, where is it taken from? It's taken from section 35A. This is section 35A of the Pharmacy Act, which speaks about good pharmacy practice principles. I also added this here, so I will further explain. So you start from section 35A because it's a legislation. The GPP is not legislation. It is taken from legislation, okay? Then in section 35A, it speaks about GPP principles, which are here, which are explained in this part. So you then add these ones. And then when you add your evidence, you already understand what was the requirement and how I'm going to fulfill it. Then when it speaks about informing the patient about generic medicine, first of all, understand where does it speak about informing the patient. This speaks about section 22F of the Medicines and Related Substance Control Act. But how do you then provide proof that you did inform the patient? What will you submit to the assessor? Then here, maybe you can speak of developing a checklist that you're going to use and then include that you showed that you did apply the requirement of this, and then you've added it as part of your evidence. Okay. So now, talking about how I then applied. Let's say that I want to show the assessor that I applied regulation 33 of the Medicines and Related Substance Control Act. First of all, please read your regulations. Even if you're using someone else's work, please read the regulation. May I please kindly ask that you post all the questions in the chats, because I'll be opening a Q&A session before we are finished. The session is supposed to take not more than 30 minutes. So I think by 18:10, we should be done. Look at what the requirements are. So it says that every prescription shall be either written in legible print it shall be written in legible print, handwritten or typewritten. So you check, is your prescription typed or handwritten? Then you can then say, okay, my prescription was typed or my prescription was handwritten. Then you check if it was prepared with an electronic, electronic signature according to this act, but it's fine. And then 2, it tells you that the prescription shall be signed. So if the prescription is not signed, unfortunately, it will not be, you will not be applying the requirements of this regulation. Then it tells you that it needs to be signed by an authorized prescriber, which means you must check the prescriber's details. You must ensure that the person who is prescribing this medication is someone who is known at the pharmacy. So when you annotate your work, start by adding a title. Okay, this is evidence 1, because this is the format I want to include. And what does it show? I'm telling the assessor that this is regulation 33 of the Medicines and Related Substance Control Act. And then in application, this is where interns normally get it wrong. Remember, what behavioral statement are you trying to apply here? Let's say that you're doing domain 3.4, and you're supposed to be dispensing, and then you are applying behavioral statement A, okay? What does the behavioral statement require of you? you're supposed to make sure that the prescription is prepared according to legislative requirements. What do the requirements want of you? It asks you to check if the prescription is handwritten or typed. So you can make an arrow here, and then you add a text box next to it. If I want to explain that this prescription was handwritten or typed, I will first say that this regulation requires that a prescription is either handwritten or typed. Okay? Brief description of what's happening. How did I apply it? I checked if my prescription was typed or handwritten. I saw that the doctor wrote the prescription by hand, signed it, and included their MP number. This is linked to behavior statement A. So I brief description of what's happening. I speak of how I applied it by saying I then did 1, 2, 3. Okay. Moving on, looking at the rest of the prescription, just check what's going on here. Let's say maybe the prescription is a Schedule 6. Okay. Where is this? Okay, maybe let's see. Let's say I want to annotate this. I will talk about the Schedule 6 later on. Let's say I want to annotate and say that I wanted to check that the date of issuing of the prescription is valid. Why am I speaking specifically of this? It's because it links to another law that speaks about the requirements for a prescription to be presented. Okay, so I start off by giving my evidence a title. Remember, I said that one was evidence 1. So now this is evidence 2. Evidence 2. And then what does it show? This is still Regulation 33 of the Medicines and Related Substances Control Act, or whatever that I say. And then in application, I will just provide a brief requirement. The regulation requires that the prescription be provided with a date that's within 30 days or whatever the case might be, or that the prescription needs to have a date. Then what did I do? I then checked the date of my prescription. I saw that the prescription was presented for dispensing on the 10th of May, 2026. According to Section 22A of the Medicines and Related Substance Control Act, the prescription needs to be presented for dispensing within 30 days. So this prescription was compliant to Regulation 33 and Section 22A. And then after that, I link with the behavior statement. Remember, I talked about just brief, what does it require of me? And then what did I do? Or maybe let me say what I did. And then I link with the behavior statement that speaks to that shows that I am actually applying this. First, understand the behavior statement you are addressing. Don't just say that the prescription was valid. What do you mean the prescription was valid? What did you check to ensure that the prescription was valid? What was wrong if the prescription was not valid? If the doctor did not write a date, what did you then do? Maybe you talk to the doctor and then you record this, because anything that's not recorded did not happen. Okay. Another way to apply this with ease is to create a checklist. If you're maybe dispensing, then create a checklist of the requirements from Regulation 33 of the Medicines and Related Substance Control Act. It requires that there needs to be a name, practice number, qualification, and address, and all of those things. So if it's provided, then you tick. If it's not provided, then you can add another comment box here, comments of what you did, because maybe the doctor did not include, maybe let's say the dosage form. I then went on to communicate with the doctor to ask them to include 1, 2, 3. Okay, remember, you include a title of your evidence. This is evidence 3. And then 2, I am checking what it shows. This is a checklist I created to apply Regulation 33. And then 3, I am speaking about application, okay? So 1, I'm just providing a brief description of what's happening here. This is a checklist I created from Regulation 33 to ensure that I check the prescription I am dispensing for compliance with this regulation. Okay, what did I then do? I checked each requirement according to the checklist I created. When the doctor provided the requirement, I ticked it. If the doctor did not provide it, I ticked no. Okay, this is linked to behavior statement A or B or C. You are providing all the requirements from that behavior statement. Okay, so now you then have a prescription. Now you want to show the assessor how you applied those requirements. Let's say that you're doing domain 5.3 and you're dispensing medication and you're using Regulation 33 to show the assessor that you know how to apply the law in your practices. First of all, you understand the requirement of that behavioral statement. You read the regulation 33 and you know what it requires of you. So you're looking for key areas that then show that, oh, okay, this person understands what's going on. So what you do is you then go on to highlight the text that you want to discuss. You don't just write on top that I checked this prescription for compliance and then I saw that it complied. You're looking for the requirements according to that regulation. Let's say that the requirement asks you to check the doctor's details. Okay, then these are the details here. So what do you then do in checking the doctor's details? You are going to then come here and put maybe an arrow here. Then remember, what behavioral statement am I addressing in this one? So maybe I'm going to add a text box here. Okay, so maybe let's say I want to annotate for behavioral statement A. Provide a brief description of either what this shows or what the requirements ask of you. Regulation 33 asks that the doctor provides their name, their qualification, and I think their MP number as well. So I will also add this here and point it towards the text box. So brief description, what is happening here? I checked the requirements according to Regulation 33. Brief description. These are the details that the doctor provided, their name, surname, This is required by Regulation 33. Application. I checked to ensure that the doctor's name was clearly indicated, that their qualification and then their MP number is included. The key difference between Regulation 28, that old regulation, and the new one, is that the doctor needs to include their MP number. So this is very important. Okay. After highlighting this text, I am going to add on the application, and then at the end, I'm linking it with the behavioral statement that I want to address. But that's not the only thing that's required of you whenever you're annotating a prescription according to Regulation 33. You are supposed to also check the details of the medication that are provided in that prescription. You're checking the name of the medication, the dosage, where it's supposed to be taken. Is it orally? Is it an injection? And all of those things. Dosage forms are supposed to be indicated. If the doctor did not indicate, don't take it lightly that counsel understands. Then maybe add a text box here, just to say that I communicated with the prescriber and asked what dosage form they wanted to give. Don't take it lightly. Don't, just make sure that your work complies with those requirements as it is. Okay. And then the dosage frequency is also indicated. Then the doctor wrote that it's supposed to be indicated for 10 days. Then at the end, include the quantity that you then dispense, because they are going to check all of these things. When you check domain 2.6 in terms of your calculations, when you write the exams, these are some of the things that they look out for. Maybe there's tramadol, 100 milligram, but it only comes as 50. All of those things are actually looked at. Next up, you're supposed to look at all the details, and then you indicate the quantity that is then dispensed here. You then sign or maybe add your details, but now with these new systems, it allows you to add your details here. Then you add annotations as to what you are covering. Okay. Linked to behavioral statement A, maybe in domain 5.3. Regulation 33 requires a prescription to include 1, 2, 3. I then check to see if the doctor indicated all of these details, including the name of the medication, the dosage frequency, and the quantity the duration of the treatment. This can be something that you add and indicate yourself. And then after saying that it complied, I then, ticked or indicated the quantity, whatever that you can say in relation to that. Then checking the dates as well. You can see that this is when the prescription was written, and this is when it was dispensed. So according to section 22A, it requires 1, 2, 3, that a prescription be presented within 30 days before it can be dispensed. What did I then do? I then checked whether the prescription was presented within this time limit. I saw that the doctor wrote it on the 2nd, and then I dispensed the medication on the 3rd of January 2025. So this prescription was valid according to this law. What I did is I told the assessor what is required. I told them how I then applied it. And then I mentioned explicitly which behavioral statement I am covering. Okay. Coming here now, you can already see that I covered the patient's details. So now if I was doing domain 5.3, I would have linked this to behavioral statement E. Why am I linking with behavior statements E? Because section 1.3 of the GPP, the code of conduct, requires that I maintain patient confidentiality. Okay. And then in application, I am telling the assessor, just a brief explanation as to what's happening here. These are patient's details, but they are covered according to the code of conduct. Okay. I applied principles of confidentiality according to section 1.3 of the GPP. Sorry. Okay. According to section 1.3 of the GPP, I cover the patient's details for the purpose of this CPD and ensure that confidentiality was maintained, linked to behavior statement E. I hope this makes sense. Okay. Moving on. Now, this is on domain 1.1 on public health campaigns. Here, one of the common mistakes that interns make is that they don't show application in the work that they then provide. Maybe they provided a brochure, maybe they provided a presentation. You're supposed to annotate which behavior statement does your work cover. Okay, so now I'm pretty sure that you understand, health promotion, disease prevention and control, because I've provided a video online that explains these behavior statement, just to break them down so that you understand what is required of you. But in domain 1.1, they don't only want you to know the behavior statement, but they want you to understand what is required. Where did you get the information about health promotion, disease prevention and control, and want to see how you applied it. Okay, so now we are going to focus on behavior statement C, which is providing advice on healthy lifestyles. First of all, I include a text where found. Next up, I am going to include a title for my evidence. So here we are going to say this is evidence 1. Evidence 1. And what does this show? This is section 3.6 of the standard treatment guidelines. Okay. And then how did I apply this? I'm remembering what was the requirement of the behavior statement I wanted to include. If it's a whole text, I'm going to highlight the text that I'm covering. So maybe I want to tell the assessor about this text. Okay, I'm going to add a text box here. Remember the checklist. You're going to link to the behavior statement. Whenever you have a text, whether there's many texts, each and every text should be linked to a behavior statement that you want to address. Okay, just don't have the whole text here, but let's see. Okay, maybe let's say I'm saying here on top, I'm saying linked to behavior statement PS, B, and C. Okay, so now here in my explanation, I'm supposed to break it down. How does this text cover behavior statement B and behavior statement C? Okay, let's say I want to then, let me just then erase this. In my text, I want to show the assessor how both are covered. I will maybe start here. Okay, and then I will do this, and then I will also add this one. Okay, so maintain ideal BMI, less than 25 kg per meter squared, weight reduction in the overweight patient. So how can I link this? Maybe let's say I linked this with behavior statement B. Why am I linking it with behavior statement B? Because behavior statement B is about disease prevention and control. But how is linking this with behavior statement B? Maybe during the training, I included a scale that, patients were able to weigh themselves and then their height, and then I give them their BMI. And then I explained to the assessor that this section of the standard treatment guideline requires that normal, ideal weight is less than 25 kg per meter squared. And then I speak on application. I ensured that there was a scale at the campaign and a tape to measure height. I then asked the patient to weigh them and give them and check their height so that I could calculate their BMI. I then told them their BMI and wrote it down. And then based on that, I advised them on how to eat. So you see, I am telling the assessor what am I doing? What behavioral statement am I linking it to? And then I speak on application, speak on how you apply the evidence. Okay, moving on, this one speaks of salt reduction. How can I link this to the behavior statement? I link it with behavior statement C. Why am I linking with behavior statement C? Because it's about lifestyle modification. And then what am I going to speak about? I'm going to speak about salt reduction. But how did I apply it in the public health campaign? Okay, maybe let's say I link it to behavior statements D because I'm also seeing something here. Okay, for behavior statement C, I'm going to explain that. Behavior statement C is about advising patient on lifestyle modification. How did I apply this? During the public health campaign, I educated patients about the importance of limiting salt reduction. This is the, Yabona, if you forget any of the linking, remember salt. Salt is one you can, just go ham with. Remember eating right. So you're going to then apply. During the campaign, I then educated the patients about reducing salt intake and then increasing the amount of fresh fruits and vegetables. I educated them about the importance of starting, a backyard garden, even if they plant spinach and all of these things so that they can live healthy and exercise. Linking with behavior statement D, maybe you had a dietitian who was there at the public health campaign and the dietitian spoke about this. So you can link to B and say, behavior statement D asked me to participate. So at the campaign, I had a dietitian who was there who was speaking on 1, 2, 3. That's how you applied it. Then you link with the specific behavior statement. Avoid just saying linked to behavior statement B, C, and D and leaving it at that. Or maybe you're saying this and then you add the text there. It's okay, but there's a better way to do it. Link specifically to that section of the text that you want the assessor to see. Moving on, let's say now you are, creating material that then educates the people about whatever you were educating. Remember, you give it a title. 2, you tell us, what does this show? And then 3, you're going to speak on application. When you speak on application and linking on evidence, make sure that it goes together. Let's say maybe I want to annotate on this. So I'm going to put a text box there, and I want to annotate on this, and I'll put a text box here. So here, I'm going to link it to behavior statement A. I am reminding the assessor of the requirement of behavior statement A or why I included it. It requires me to provide advice on health promotion, which means that educating the people about, the causes of blood pressure so that they can take better healthcare decisions for their lifestyle. How did I apply it? I created a brochure that covered the causes of hypertension so that people can know, okay? I applied it and then I link it to behavior statement A. Then here I'm linking it to behavior statement C. Behavior statement C asked me to ensure that I provide advice on lifestyle modification. During the public health campaign, I educated patients about the importance of losing weight, reducing alcohol, reducing stress, increasing fruits, eating fruits and all of those things. And then I link with behavior statement C. You're speaking of, what does it show? Application, link with the behavior statement, all the text that you have. Okay. Moving on, now I'm going to speak about how to annotate an SOP. This is according to domain 4.6. I see that many interns struggle with this one because, it's tricky. First thing you want to do, read your SOP that you're doing. If your SOP is going to speak about a lot of activities, maybe let's say it's receiving and it's a lot of things. Remember the activity that you're doing. If it's receiving, focus on receiving. If you're going to focus on supply and cold chain, then focus on that activity that focuses to cold chain. And then when you apply the work that you apply, make sure that your SOP is valid. It does not have words like MCC. Once it has MCC, I'll just know that the SOP is off. Make sure that the prescription is also signed as well. Then the next thing you want to do, you want to check what the SOP requires of you. Okay, so now you have a specific step in your SOP that speaks about the specific things. I think, let's touch it, it's fine. So when you add your work, before you add how you apply the SOP, cut this. So you cut this, you include it at the top, then you include application, so that the assessor is not confused as to the behavior statement that you're addressing. Then look at the requirement of each step in the SOP. Very, very important. Okay. So here it says that note the order number, invoice number, and invoiced price on the goods received note for the received items. So on that document that you then include, you annotate specifically about these requirements that they are talking about. Okay. You look at all these steps and you look at what you would then need to include. Receiving personnel to complete name, signature, date, and sign. So you're going to go to your goods received note. Again, please make sure that your evidence is visible. Don't include a picture there so that the assessor has to wear glasses to see what's going on. Make sure your evidence is okay. And then annotate, add the details as to what's going on there. What is this showing? And then you are showing the requirements. Okay, this is my name, my signature, and I signed on the goods receipt note. And then this is the date where this activity was done. Ensuring that the date is provided also makes sure that your evidence is valid. Then the store's assessor completes in all of these things. So look at all the requirements of that SOP. Next up, if your SOP says that you need to receive and capture, make sure that you capture it. Then it says that, 12.1, click on the receipt icon. Then take a screenshot of RX Solution or Leap or Profile, where you are clicking there. Then click the plus item. I know it, click the plus icon. Where? I know it's a lot of work, but ensuring you do it like this, make sure that your evidence passes first time. You don't have to then come back, because if your evidence fails and you try to amend all work, maybe there's a new date there. Oh, it's over for you. So just make sure that all of this, check everything, check the requirements, and then apply it. Okay, so now moving on to annotating a picture. When you annotate a picture, first of all, identify yourself. Who are you in this picture? The next thing, requirements. Okay, not first of all, but part of the requirements, remember the title, what does it show, and then you identify yourself, and then you link with the behavior statement. Already here, sometimes when you take evidence, take a video of the evidence so that you can be able to come back, take screenshots of what you wanted to show. So let's say here I want to tell the assessor about behavior statement G of domain 2.2, which is applying language, verbal and non-verbal cues. So I am remembering what the behavior statement requires of me. Behavior statement G is about a language, verbal and non-verbal cues. So in the language, what language will I use? How will I show this? Then I'm going to show the assessor the language that's used on the label, or the language that I'm going to use on the material that I then provide. Okay, and then it also speaks about verbal and non-verbal. Sometimes you can see when a person is talking, or sometimes you can't, but you can then explain this. Non-verbal cue speaks of pointing. So I'm going to put an arrow here. I'm going to put a text box next to it. I'm going to put the behavior statement, briefly what it shows. And then I link with the behavior statement and I explain. For instance, this links to behavior statement G because it requires that I use verbal or non-verbal cues. I applied this by doing 1, 2, 3. I pointed on the material. I pointed on the label to show the person where to check for the instructions. Maybe there's also like a warning label here, keep in what, or store in the refrigerator if it's insulin, or whatever the case might be. Maybe I want to show how I applied this very same thing on the package information leaflet that I provided to the patient. Then I'm pointing on the exact area where I want the patient to see to get the information that they wanted to get. Okay. Again, now you're annotating a regulation. I was speaking about Section 35A of the Pharmacy Act. This is very important. When you are doing domain 5.3, if you don't have Section 35A of the Pharmacy Act, you are playing games. This is because it's the gift that keeps on giving. When you check the different sections of this act, it will tell you the requirements. For example, here, you can link this to behavior statement B. Then apply the requirements, like I said. Here, it speaks of the code of conduct. Code of conduct is linked to behavior statement E. Then you apply the requirements, like I said, with this one, how you can go ham here. It speaks about any other activity that you can link the regulation to that is, a pharmacist can do. In the GPP, if you're able to link the GPP to Section 35A, you've complied with behavior statement A. You've complied with behavior statement B, because then you can add regulation 5 and 6 of GNR 4733 of 2024. Then behavior statement E, you go on and add the code of conduct. So here, what constitutes good pharmacy practice, you can add anything. Pharmacist-initiated therapy, conducting a public health campaign, documentation, requirements for a pharmacy, the services for which a pharmacist can levy a fee. You can link this to many things. You can link it to behavior statement C, making comments about where you can levy fees. There was recently a publication in the SAPC about Section 22C dispensing regulations. If you can make comments on this, then I can then go on and say This is behavioral statement C. Why am I linking it to this? Because this will speak about who can dispense, how can they dispense, where are the laws that speaks to this. Then linking it with the comments, then I'm able to show the assessor what my understanding was. Okay. Here, this one can also be linked to behavioral statement A about inspections. There's a document a pharmacy council also published about self-inspections. So you can use this as a way to assess if your pharmacy is compliant to those regulations. Okay. I think that's it. Okay. All right. Thank you so much. So yeah, it wasn't long. But thank you so much. Thank you so much for your time. I think, and I hope this clarified a few things that interns were particularly struggling on. I will now open for like 10, okay, let's say 5 minutes. 5 minutes for interns to, okay, not interns, for you guys to make your comments, to ask your questions so that I can provide guidance as well. Okay. No questions. I covered everything and all that you could ever want to ask. Everything is provided for. Okay. All right. Thank you so much, everyone. I truly appreciate your time. Have a lovely day. May I please ask, if you didn't ask the questions here, please don't text me privately, because I'm creating this platform so that you can ask. Because sometimes, if and when you do ask, I may take a bit of time to respond. So I create such platforms so that you can be able to then have all your questions answered. Okay. So nothing from you, Kai. You are sorted. You are going to pass all your work. Okay. All right. No problem. Thank you so much, everyone. Have a lovely day. Goodbye. Hi. How can I assist you?
I am talking.